Hi, my name is Param Eftekari. I'm the co-founder and EVP of Research at the Health Tech Council. And we're here to talk with our two esteemed guests about patient-centric care and the role of IT in achieving this goal. To my far right is Keith Crawford, the SVP of Strategic Initiatives at Quorum Specialty Infusion. And to my right is Morten Petersen, the CEO of the Danish National eHealth Portal. Keith, I'd like to start with you. What do you believe we're overlooking when it comes to truly meeting healthcare reform's goals of patient-centric care?
Well, currently, the centroid of care is surrounded by the hospital, and all of the providers focus their care on that particular location. Healthcare reform has actually moved the centroid of care to the patient. The majority of the patient's interaction or impact on their total cost of care takes place in the home. And so our focus is to actually turning the patient into the centroid of care and developing the EMR or the personal health care record around that patient.
Interesting. And Morten, you obviously have a very different perspective coming from Denmark, who many of us here believe is much more advanced in terms of using IT to support healthcare. I'm wondering, from your perspective, why do you think it's important to look outside of the hospital when it comes to resource allocation in support of healthcare reform?
Until now, we have used almost our resources, also like in America, looking inside the hospitals. We have been embracing and we have been developing our EHR and so on. But I think that our healthcare system is under pressure. And it's under pressure because we have a lot of chronic diseased people. And our answer to those challenges is to pull out the resources outside the hospital. We really have to empower the patients to make it cheaper for them and for the hospital and for the healthcare system to stay out there. So we have to empower the patients with our electronic devices to help them stay out where it's cheap and where they are more healthy.
Absolutely. It sounds like both of you are really saying we need to really focus on the home, because that is where we spend most of our time, and that is where we should be receiving most of our care. It just makes kind of logical sense. And I think in closing, I would like to ask each of you, what advice would you give your peers when it comes to supporting patient centricity within their organizations?
Well, I think, if you look at 2011, $2.7 trillion were spent on healthcare, with 75 cents of every dollar spent on chronic conditions. And to Morten's point, most of those chronic conditions are managed in the home. Things such as remote monitoring and frequent interactions with those patients in the home have been proven in much of the literature to reduce the cost of total care of those particular patients. So I would say to most of my peers to remember, as we build out these accountable care organizations or electronic medical records, to remember that most of that care is going to be taking place in the home, and to make sure that that is part of their strategy fabric as they go forward.
Absolutely. Morten?
My answer would be that we should really have a focus on making it possible to have a communication between the sectors, to have communication between hospitals and pharmacies, between hospitals and GPs, and between hospitals and healthcare centers. And we have to empower all those in the systems to be one system, and the focus should be the patient.
Absolutely. Well, gentlemen, thank you so much for your time, and we hope you enjoy the rest of the conference.